Hello, and welcome to your focus group for Healthy Columbia Willamette Collaborative's Community Health Needs Assessment. You have been asked to participate in this session because we believe the knowledge you hold about your community's experiences is critical to informing the Community Health Needs Assessment that represents all communities in the four-county region. This video will talk about what a Community Health Needs Assessment is, your role in this work, who Healthy Columbia Willamette Collaborative, or HCWC, is, and what they have done since the last report to ensure that community voices influence how money is invested in our communities. HCWC stands for the Healthy Columbia Willamette Collaborative. HCWC is a partnership of public and private healthcare systems that collaborate around understanding community health needs and how best to take action. This allows them to leverage their collective resources to improve the health of our communities and the quality of services they provide. HCWC includes hospitals, local public health departments, and coordinated care organizations in the Clackamas, Multnomah, and Washington counties of Oregon, as well as Clark County, Washington. So what is a Community Health Needs Assessment? A Community Health Needs Assessment is a report that tells us what is going on in our community in terms of health. A Community Health Needs Assessment, or a CHNA, can focus on a city, state, region, and/or nation. This CHNA will focus on the Washington, Multnomah, Clackamas, and Clark County regions. A CHNA is typically used to inform future community health improvement plans and how money is invested in community health and well-being. For example, if a Community Health Needs Assessment shows that community members require more accessible health services, including language interpreters, this could result in a hospital or health system expanding translation services. Or, if communities highlight housing as one of its greatest needs, this might result in a health system investing in an affordable housing project. A CHNA involves a few steps. First, gathering information from community members. Secondly, gathering additional information from reports and other data sources. Third, combining this information into a report. Then, health systems use this report to inform a community health improvement plan on how and where to invest time and resources in our communities. Lastly, health systems implement this plan. Ultimately, CHNAs help health systems determine where money and programs should be focused for community health improvement. CHNAs are often required every 3 to 5 years in order to continue to receive funding. So, how will your voice influence this CHNA? We will ask you a series of questions that we will discuss together. Your answers will help to tell the stories of health in your communities, barriers to health, and any other information health systems should know in order to improve community health. It is also important for community members to know and be aware of what is going on in their community and when decisions are being made about their communities. This helps us all connect dots, build solidarity, and create strategies to address the issues that impact us. A goal of this CHNA is to be community-centered and equitable, representing communities that are often left out of the data collection process or who don't control the data and our stories about themselves and their communities. This project has a community action team, a group of 10 community members who have guided this process. They have written the questions we are asking you today, and they also advocate to ensure your input is fully and authentically integrated into the final CHNA report. What has the Healthy Columbia Willamette Collaborative, or HCWC, done with the information from the last CHNA? Many HCWC members use this information to inform their programming and community investments. We thought it was important for you to hear about some of the progress that has been made since the last CHNA. Since the last CHNA in 2019, in Clark County, the report was used to create an online mapping tool which ultimately put data in the hands of community-based organizations to help them develop programs and get funding. It also helped build a new emergency room and social services center to prioritize the needs of their low-income patient community. Trillium and Care Oregon decided to focus on Black, Indigenous, and people of color communities, as well as houseless communities, when investing money in community projects. This included investments in housing, community health navigators, and trauma-informed care. Other organizations like Legacy, wanting to uplift communities' needs, opted to shift investments to address needs arising through COVID. Hillsborough Medical Center used the last CHNA to inform many changes, including providing enhanced interpretation translation services to non-English speaking patients. It also began a Diversity and Inclusion Committee and Patient and Family Advisory Council to help gather information for providing culturally appropriate care. Adventist Health Portland hired Russian Slavic-speaking health navigators to work with patients and community members. They have also worked with area Slavic media, faith communities, and related organizations that resulted in increasing the numbers of Russian/Slavic individuals enrolled in health insurance. Kaiser Permanente Northwest recently awarded $700,000 in grant funding to 7 community-based organizations across our footprint to support homeless services with COVID-19 prevention and response. Funds will be used to respond to specific local needs, enhance coordination, and build capacity among local public health departments and homeless healthcare providers, including providing motel vouchers, ensuring community clinics are safe and can treat patients, prevention and testing programs, street outreach, and more. In Clackamas County, the last report resulted in a decision to focus investments on uninsured, underinsured, migrant worker populations, and Latinx and Native American communities. In Washington County, the last report resulted in grants for community health workers, trauma-informed care supports, and culturally appropriate care for refugee and immigrant patients, building trauma-informed care training for staff in multiple community-based organizations, and a peer program for Spanish-speaking seniors. Health Share of Oregon used the last report to focus investments on supportive housing, access to care, social connection, food access, and chronic conditions, as well as building connections across health systems and clinics, social services agencies, and public health to strengthen and amplify pathways for families to address health disparities. Providence, focusing on Black, Indigenous, and people of color communities, especially Latinx communities and unhoused communities, provided thousands of meals and food boxes, supported the building of a transitional housing complex in Southeast Portland, and provided health insurance supports to help enroll thousands of individuals in healthcare coverage. How will the results be reported out to community members? A final report will be available to the community upon completion of the project. We commit to ensuring that you are able to access this report when it is completed in fall of 2022. Finally, thank you for participating in this process and for sharing your experiences. Participating is a valuable next step in getting the investments our communities need to be well and whole.